Thanks for joining us today for the Wisconsin Workforce Development Association's Talent Development Council meeting. We're going to go ahead and get started. It's 3 o'clock now. I know we'll have a number of folks kind of continue to jump in. If folks have questions along the way, you can post them in the message portion of the Zoom, and we'll do our best to answer them. If we don't get to them today, we can certainly follow up afterwards. So wanted to start out and introduce myself. My name is Josh Morby. I'm with the Wisconsin Workforce Development Association's Talent Development Council. To give a little overview of the TDC is the TDC is a unique membership opportunity for employers, trade associations, small businesses, even individual employers that are looking to engage with Wisconsin's workforce development system. We represent all 11 of the workforce development boards around the state. And what we do at the TDC is we provide you programming like we're doing today. We used to provide in-person networking opportunities, but now you get the joy of doing that on Zoom. We're also involved in helping influence funding priorities for workforce development issues. We work with elected officials both at the state and federal level. So happy to engage with you. Please don't hesitate to follow up with me afterwards with any questions about workforce related issues. For what I'd like to do today is to start by introducing our panel of speakers. And we're gonna start with, I'll introduce everyone and then I'll turn it over and make them the host for the meeting, and then they can give a little presentation. So Ruth Schmidt is the Executive Director of the Wisconsin Early Childhood Education Association. And Ruth is gonna give kind of a quick overview of kind of what's happening in the industry from the Wisconsin Early Childhood Association's perspective. We also have the opportunity to hear from Secretary Caleb Frostman, Secretary of the Wisconsin Workforce Development Association. We'll also hear from Margaret McMahon. Margaret is a longtime policy advisor for a number of agencies, and she's currently at the Wisconsin Department of Children and Families. We'll also hear from Louise Wilson. Louise is a school nurse and health services consultant with DPI. And so Louise will give the medical clinician kind of perspective on these issues. We'll also get a chance to hear from Sheila Briggs, who is the I think the Assistant Deputy Secretary or Deputy Secretary at Department of Public Instruction, and I'm sure she will clarify that when she speaks. So Sheila will be able to give us a little more perspective from the Department of Public Instruction and hopefully confirm that there isn't a secret plan going on with virtual schools. So that's kind of a joke, but I'm going to start by turning it over to Ruth. And Ruth, if you give me just a minute, I'm going to make you the host. And then when you're done, you can make me the host again. So Ruth, can we hear you?
Can you hear me?
Yes, ma'am.
All right. The only thing you might have to do is talk me through making you a host again at the end.
Okay.
Or maybe I'll just take over the meeting and spend the entire hour talking. Okay, so good afternoon. I'm Ruth Schmidt. I'm the Executive Director at Wisconsin Early Childhood Association. And just by way of explanation, my organization provides services that support childcare programs across the state of Wisconsin. And we advocate for sound policies and for investments for a strong early care and education system in our state. I want to start by asking you, what do these publications all have in common? So CNN Business, the Washington Post, USA Today, the Wisconsin Journal, the Post Crescent, and Newsweek.
And that's a rhetorical question.
That's rhetorical.
Okay.
That's a rhetorical question. But if you want to guess, Josh.
Fake news is not the answer.
Fake news is not the answer.
Okay.
But the answer is that within the last 2 weeks, they have all posted articles about the impact that childcare losses are having on business and will continue to have on workforce issues. So headlines from: many parents may have to stop working entirely if schools don't reopen, Goldman Sachs says. Employers, childcare, and returning to work in COVID-19. Coronavirus childcare crisis will set women back a generation. Coronavirus pandemic creates America's first female recession amid childcare and unemployment woes. COVID-19 pandemic changes childcare landscape for providers and for parents trying to return to work. Governors can reopen all they like. Without childcare, parents can't work. You can Google all of those and find those articles. They're compelling reads that sort of set the landscape about what's going on in childcare. So I'm hoping that we can all sort of agree on two things. First of all, Wisconsin parents cannot work without childcare for their young children and without a safe place for their school-age children to be in classrooms when our schools are not open or when our school classrooms are closed. And two, COVID is dramatically challenging the ability of our schools to open safely and has for the past 5 months already been posing hardships on childcare programs, causing many to close or take dramatic reductions in revenues. Before COVID hit, half of Wisconsin was defined as a childcare desert. In rural communities and rural counties, that number jumps to 70%, defined as having more than 3 children for every childcare slot that exists in the community. The average wage rate for people that work in early care and education is $10 an hour with an associate's degree. The turnover rate is pushing 40%. And over half of our childcare workforce relies on public assistance. So if we want to look at what's happened since COVID and what has the impact of COVID been, how have those numbers changed? What are we seeing? The first thing we know is that there's tons of studies being done on what is happening in childcare and what's the impact it's having on our economy. What we know is that we anticipate in Wisconsin to lose upwards of 25% of our total regulated care, which is over 40,000 slots, so 40,000 potential families without childcare slots. And if you look at a study that has been done by the National Association for the Education of Young Children, they are currently saying that by the end of the next year, we will lose 80% of all of our childcare capacity if we do not have a major federal relief fund targeted to childcare. In Wisconsin, 40% of our programs are already closed. Of those that are open, they are operating at less than 50% capacity, which is simply not a sustainable way for businesses to operate. A study done by the U.S. Chamber Foundation of employers across our nation has found that 40% of employers are concerned that some of their employees will not fully return to work. And another 25% of employers are reporting that they are concerned that they will lose a workforce entirely as a result of a loss of childcare in their communities. Before I close, I always like to pose challenges for leaders as they're considering these sort of critical issues. I think the other speakers today are going to do a much deeper dive into some of this information from their different department perspectives. But I did want to take a moment to at least leave you as business and industry leaders with 3 possible actions that you can take. The first is that on a federal level, the House of Representatives has passed a Child Care is Essential Act with funding of $50 billion to support childcare. The Senate has passed the HEALS bill, which is funded with an additional $15 billion to help bail out childcare across our nation. We're hoping that the final result will somewhere be between the $15 billion and the $50 billion, one on the low end, one on the high end, probably, with negotiations happening with the White House. It's critical that if you have a chance, you lend your voice to advocacy and calling your federal delegates and letting them know that you support a financial relief fund specifically for childcare, and that it definitely impacts business and industry's ability to be profitable and contribute to a functioning economy. At the state level, my association and partner organizations that we work with across the state are going to be lobbying for a new $30 million childcare stabilization fund to help childcare programs stay open. We will be advancing a comprehensive legislative agenda going into the 2021-2022 legislative session. Your support will be needed if we're going to get folks in the Capitol to do the right thing for children. And locally, it's critical that business and industry recognize the rate at which they rely on schools being open and childcare being available. And we need you to lend your voice to conversations happening in local communities across the state of Wisconsin. If there is not a conversation happening in your community between your school district, business leaders, and your childcare industry, you need to be starting those conversations. It is critical that business and industry leaders get a deep understanding of what this looks like in your community and lend your ability to be innovative and thoughtful in terms of ways that a community can respond to what is happening right now with the loss of care and closures of schools to virtual learning as we head into the fall. I will be here for the remainder of the meeting and happy to answer questions as helpful. Thank you.
Ruth, thanks so much. That was great. I think if you click on my picture,
little buttons.
Yeah, more, and then make host.
More. I apologize. I am not seeing that. And I don't want to hold this up. I'm sorry. I am pushing on the 3 little buttons on the side of my picture and I am not seeing make host.
Okay. Click on your picture or my picture.
Yep.
Does it say make host?
Yep. There you go. You're now the host. Sorry about that. Thanks.
Okay. Well, thank you so much. I'd now like to introduce Secretary Frostman. Caleb, are you there?
I am here. Can you hear me okay?
We can hear you. Can I just turn it over to you? Do you have anything you'd like to present, or I can still be the host and you can?
Yep, no slides on my end, just conversation, and if that works, I can get started.
Yeah, that's great. No, thanks for joining us. Secretary Frostman, take it away.
Sure. Well, thanks for having me, and just know that this group, also as a preamble, this group has a reputation for being particularly insightful and valuable, and everyone that I've talked to inside and outside the workforce development world really appreciates these conversations. So thanks for hosting these, and thanks for having me today. It was interesting. I was at another call this morning with Wisconsin Manufacturers and Commerce, talking about the trends in unemployment insurance and how it's obviously affected our economy and the work that we're doing at WWD. And for this group, I'm sure at no surprise, our primary focus these last 4.5 months, excuse me, has been on unemployment insurance here in the state and the claimants that we're trying to serve. However, it's been pretty clear that the historic consequences of COVID-19 have laid bare some pretty serious cracks and fissures in our economy that were present post-COVID and have been widened by the virus, including glaring racial inequities, some of which some of the articles point to Wisconsin being among the worst, if not the worst, in the country, growing income inequality, grossly inadequate broadband throughout parts of our state, underpaid, underappreciated educators and childcare providers, things like an aging population, uneven access to medical care, and uneven and inadequate access to quality childcare. Ruth hit home a lot of really hard-hitting stats that are kind of a gut punch to a lot of us. And, generally speaking, prior to COVID, a big, part of our focus, or at least the collective focus, has been on how to get more people in the workforce. And we talk about, or have talked about, childcare. That has been seen as an impediment, potentially to some parents. But what we've seen in these last few months, really draw that stark line in the sand as far as what it means for parents who are already working and what it means for people that are already in our workforce. And that's something, for a brief, kind of soapbox moment, from my perspective, the amount of focus paid on getting more people into the workforce is certainly an important endeavor. But prior to COVID, we had 3 million people already working in Wisconsin. So one of my areas of focus was how we can help support those folks that are already working. What can we do to improve their quality of life and their, balance as it relates to work and to home, and how our programs can help lift our current workforce, which in turn will help strengthen our economy for entrepreneurs, for business owners, for workers. And I think, as challenging as the last 4.5 months have been and continue to be, we at DWD really do see this economic and social inflection point as a once-in-a-lifetime generational opportunity to hopefully redefine the relationship between work and quality of life for residents in Wisconsin, which includes the hours that we work, where we work physically, and where our families' needs fit into that work-life formula. So, that's what we've been noodling on as we pivot into, a recovery mindset. Obviously, we're still very, very busy working on unemployment insurance claims, and those do seem to be tapering a bit, which is encouraging. But things that we've been encouraging employers to consider are perhaps intuitive, but we still, like to have the effect of repetition. But considering flexible work arrangements, that includes things like teleworking, flexible hours, staggering employee shifts, rotating days in the office, considering part-time work. And then I'll speak more robustly about a program we have called WorkShare, which has been wildly popular throughout COVID-19, that has helped keep people on their payrolls, at least partially, attached to their benefits, and also has provided some partial UI benefits. But it's interesting because a lot of these concepts were things that, we were talking about and having employers consider it. And we spent a lot of time last year asking successful employers what they were doing as far as their policies that they felt helped their recruitment and retention of employees. And a lot of these things were on that list, that they were flexible with families, with people that wanted to be working remotely. That would sometimes allow a condensed work week. So a lot of the best practices that we saw in a 3% unemployment economy are some of the things that we're really encouraging employers to consider in this new post-COVID reality. But part of that flexibility helps employers be and employees feel more socially responsible. And in some cases, you can see improved attendance and productivity. And I can say strictly anecdotally, but at DWD and among other state agencies, I think a good portion of our divisions have actually seen increases in productivity since transitioning to a work from home environment, which may or may not be the standard operating procedure going forward. But I think a lot of us have been pleasantly surprised. And maybe it's fewer distractions, maybe it's cutting the commute. I'm not sure what it is, but I think we've been pretty pleased at a lot of the areas in terms of productivity. That could have an impact on morale and also on that work-life balance that, the thing that I talk about with my staff when we sit down and vision and plan for, our workforce development programming, is that the American dream that we all signed up for and the social contract that we are believed to have signed is that, the wages and benefits from full-time work should be enough to not only cover your basic needs, but invest in your future, invest in your family, and invest in your community. And so if employers can be flexible, of course, providing adequate wages, but if there are ways to let employees find themselves more engaged in their communities and or with their families, of course, we are very encouraging of that. And I guess I do at this point want to jump into a description of WorkShare. So WorkShare has been around for a couple of years. It's a program that allows employers to reduce hours of their employees from 10% to 60% of the hours, and then those employees would receive, of course, prorated wages, but they also remain attached to their benefits and are eligible for partial unemployment insurance. And so just as a barometer of how much this has been utilized during COVID, prior to COVID in March, we had one WorkShare program in Wisconsin with, I think, 20 employees. And we may have peaked a couple weeks ago, but the highest we've had since COVID, we had 680 plans with nearly 23,000 employees on WorkShare. And so that has allowed those employees to stay attached to their health care. It allowed employers to get at least some productivity out of their employees, and has been somewhat a relief to the unemployment insurance trust fund, in that those employees are only on partial unemployment insurance. And of course, for the weeks of April 4th through July 25th, if folks were on a WorkShare program, they were also getting the federal pandemic unemployment compensation, which is that $600 a week supplement. And so we are really bullish about the efficiency and effectiveness of the WorkShare program. And we've got a dedicated staff that are working on WorkShare all the time. And under the CARES Act, which of course passed in, I think, late March or early April, once an employer's plan is approved, the federal government's going to pay for 100% of the unemployment benefits paid through the WorkShare plan. So obviously a lot of workforce development professionals on this call, I'm sure a lot of which are familiar with WorkShare, but if you're not, really would encourage folks to read up on that. We do have a pretty robust set of information on our website, which is www.wisconsin.gov/UITax/WorkShare. Very robust set of FAQs and other things that folks can either apply through snail mail, email, or fax. But if there are folks generally in the workforce world, but also in perhaps the childcare world, that is a really, we think, strong option for employers in the state and for the employees. So that is a really strong option. And then if you do have to lay off employees, either permanently or semi-permanently, we would really obviously encourage you to help those employees and let them know about applying for unemployment insurance, but also to go to jobcenterofwisconsin.com, which is our state's job exchange. And all individuals who do apply for unemployment insurance are required to register on what we call JCW, but employers can find potential resumes for free. They match the skills and abilities from those postings with what they're looking for in the job. And it really does help employers find someone that fits well. And I can't remember which is which, but I think it's 250,000 resumes were out there the last I looked, and about 75,000 job openings. So lots of opportunity for both employers and employees. And then the last thing I wanted to touch on today was for any of the potential childcare providers or people that interact with some of those folks. Another option, if folks are self-employed and are out of work, or if there are parents that have to stay home to provide for their children, another option might be pandemic unemployment assistance, also known as PUA. And there's different guidance out there. We would encourage folks, if there's any ambiguity or uncertainty, to apply, and you should actually apply for UI first so you can get potentially denied, but then that's required for PUA eligibility. But some of the guidance is that if an individual has primary caregiving responsibility for a child or other person in the household, and if he or she's required to remain at home to care for that child or person, they may be eligible for PUA, which is kind of the UI benefits program of last resort. It's meant to be for folks that wouldn't otherwise be eligible for UI. In a lot of cases, that's your self-employed, your independent contractors, your freelancers, people that don't have quarterly wages on record from an employer. So if someone is self-employed or is staying home to take care of a child, they might be eligible for PUA. And so we would really encourage folks to apply for that. If there's any question, every case is different. And unfortunately for PUA, All of the applications require our staff to touch them. It's a very manual process, whereas about 75% of our regular UI claims can be determined from our online intake system. PUA is a much more manual process, but it's a minimum of 163 a week, a maximum of 370. And if the federal government either extends that $600 a week supplement or replaces it, at least for the period that FPUC was around, PUA recipients were also receiving FPUC. So hopefully there's some resolution on that in the near term. But we've got, again, robust information on who is eligible potentially and how to apply for PUA. But for those that are self-employed or those that are had to quit a job or leave work to stay at home to care for someone, they might be eligible. And that website is www.wisconsin.gov/UIBEN/PUA. And so just really appreciate, again, all that this group does. Know that your reputation is really one of being very helpful, very, very resourceful. And I think that's probably a testament to the people that are on these calls, but really happy to be here today and happy to share some information as to how some of our programs might be able to help working parents and employers support their working parents here in Wisconsin. So thank you.
Thank you, Secretary. Appreciate the insights. And I think, for those listening, we can follow up on the WWDA website. We'll put a little blog post on this, and we can include the links that Secretary Frostman mentioned for folks. And so, Caleb, I'll follow up with your team and make sure I get those. Also, appreciate the insight. For folks that have joined kind of as we're going, we're the Talent Development Council is a group of the Wisconsin Workforce Development Association. And today we're talking to a number of folks, including we've heard from Secretary Frostman, we heard from Ruth Schmidt, who's the Executive Director of the Wisconsin Early Childhood Education Association. And we're going to hear from Margaret McMahon next from the Department of Children and Families. And we're talking today about how we address or what employers can do given the uncertainties around school start date and the challenges related to changes in childcare or even a lack of childcare. So what I'm going to do now is I'm going to turn it over to Margaret. And Margaret, if you give me just a minute, I can unmute you.
Okay, can you hear me?
We can hear you. Thank you.
Excellent. Okay, well, thanks, Josh, for having me. I really appreciate the comments from both Ruth and Secretary Frostman. It's a nice dovetail into what I'm going to talk about. So a little bit about myself. I am Margaret McMahon. I am a senior policy analyst in the Office of the Secretary at the Department of Children and Families. I've only been in that role for a short time, short defined as a month. However, I've been working with workforce development programs for over 25 years and developing workforce programs that have relied on our partnership with the workforce development boards as well as their interactions with local business. Similarly, my work on these employment programs for low-income women has underscored the importance and the necessity of strong early childhood education and childcare programs. So while I'm new to the Secretary's office, this is a good topic for me. So what I want to share with you today is a very high-level view of the early care and education landscape. Ruth touched on a couple of things, so I won't dwell on those. Also talk about the business community implications, and then, as Josh said, opportunities for business involvement in improving the current landscape. I'm going to start sort of with the return on investment. I'm not going to sit here long, but because if we didn't know there was a return on investment for quality care and education, early care and education, we wouldn't be having this conversation. But it kind of helps frame the discussion that, an early investment in early care and education programs lowers costs overall on public assistance programs, including unemployment. on our corrections programs, on our education programs, including remedial education. It also results in better outcomes for parents and children with higher graduation rates, lower teen pregnancy rates, better long-term health for families, and more assets, including home ownership. So economists have found that the positive return on early care and education investments is $7 to $17 for every $1 invested. So that's actually an investment I would take if I could, for sure. In order to measure sort of that the impact that COVID has had on childcare, if we look at pre-COVID, regardless of that evidence to support the return on the investment, non-parental childcare was in crisis even before COVID-19. Meeting both the work support and the child development goals of the program has been challenging for a number of reasons. We've touched on inadequate funding, shortage of high quality, affordable care that meets parents' needs. Ruth gave some very compelling statistics. I hope I can give some as well. That with 78% of parents with children under the age of 3 are in the workforce, and still highly affordable, high quality care that meets their needs is hard to find. There's a misalignment between the formal childcare market and the needs of the parent who have to work non-traditional hours. And these are often low-income families who work the non-traditional hours and have unpredictable schedules and struggle to identify programs with the hours and policies that they need. And there's limited access to formal settings for specific populations. We talked about, and we'll touch on again, the childcare desert. So there's issue for specific populations in the rural areas. There's issues for specific populations such as infants and toddlers, as well as kids with special needs. 80% of businesses report difficulty in finding the workers, and the lack of childcare is a significant challenge to this workforce development. I want to talk a little bit about the impact on women. In particular, pre-COVID, 1/3 of women drop out of the workforce every year because of childcare challenges. So if we just kind of talk about that for a moment, COVID has only exacerbated this issue, particularly for low-income women. Women are primarily low-income workers whose jobs disappeared because of coronavirus. Their mothers have reduced their work hours 4 to 5 times more than fathers to care for their children. And the female unemployment rate has reached double digits since 1948, when the Bureau of Labor Statistics started tracking female joblessness. And it's even worse for women of color. The national unemployment rate for Latinas was at 15.3% in June, and for Black women, it was at 14%. Nearly 11 million jobs held by women disappeared from February to May of this year, erasing decades of job gains by women in the labor force. So as the Department of Children and Families, as we continue to explore how we can connect the dots in Wisconsin between better quality childcare and a stronger economy, we have to prioritize it with an effort to move towards equitable and inclusive planning, programming, and decision-making. We want to ensure that everyone, particularly members of underrepresented groups that I've already mentioned here, communities of color, low socioeconomic populations, vulnerable populations, people with disabilities, and other disenfranchised people are included as equal participants at every level of our policy and decision-making. We want to identify systemic and institutionalized racism, bias, disparity, and inequality in our practices. And we want to analyze that data and use that information to ensure that we're not building racism, bias, disparity, and inequity into our programs. The ultimate goal is that Wisconsin's children and youth are safe and loved members of thriving families and communities. So I want to touch briefly on the 4 cornerstones to high quality care program that meets a parent's need. They include, there's access, affordability, quality, and workforce. I'll go through these quickly. Ruth touched on the childcare deserts that we experience across Wisconsin. 1/2 of children in Wisconsin live in the childcare desert, and 80% of those live in rural areas. Wisconsin has also seen a 44% drop overall in the number of family and group childcare programs, and a 50% drop in overall childcare slots since COVID. In addition, the proportion of families using the Wisconsin Child Care Subsidy Program increased by almost 20% for the same period. So less availability, higher demand. During the pandemic, families have gravitated towards smaller early care and education settings for their children, while also needing increased financial support to use this care. With regard to affordability, the average annual cost of an infant care is at $15,236. And for someone who has 2 college-age students, it really drives the point home in that exceeds the average in-state tuition for a 4-year public college and the average annual rent. When you consider that an individual in Wisconsin making $60,000 or a little closer to $61,000 is the median income household, and that 25% of their income is spent on childcare expenses. And that doesn't consider a household that has more than 1 child, less than the household median income, and different costs of care. And for single parents at a greater disadvantage, it can be up to 49% of the annual income of that single parent. So that's just the affordability for parents. The affordability for providers, as I've been reading about this, and Ruth talked about the many articles that have been published most recently, the common terminology that I have come across is that providers are operating on razor thin margins. And based on that, there's a prediction that 30% will have a permanent closure, would experience permanent closure after being forced closed for only 2 weeks. Quality. In Wisconsin, Youngstar is the quality rating system for childcare providers. And overall, we've been seeing a decline in the quality. There are definitely equity and inclusion issues. The location of many of the 3 to 5 star programs vary. Families may not have access to the high quality providers near where they live or work. Not all the programs participate in Youngstar, so they're not rated. And for families, the definition of quality may involve different factors that the Youngstar system doesn't measure. Our statistics show that there's been a 20% decrease in the number of Youngstar participating providers between December 2013 and May 2020. And then that brings us to the workforce. Ruth did talk about the earnings, earning just over $10 an hour. 52% of childcare teachers do have at least an associate degree or more. They're highly credentialed. However, childcare programs are leaving classrooms vacant because they can't hire teachers at those low wages. This is also an equity inclusion issue. Staff at childcare programs with 50% or more children with childcare subsidies had lower wages and were less likely to have a degree and had a higher turnover rate. In Milwaukee alone, 41% of childcare professionals identify as Black or African American, and 11% identify as Hispanic. I think Ruth mentioned that over 50% of childcare teachers receive at least one form of public assistance. And we're close to a 40% turnover rate for all childcare teachers. So that paints a fairly grim picture, but what has DCF been doing? The department's vision is that all Wisconsin children and youth are safe and loved members of thriving families and communities. So in order to move us forward in this mission, one of the department's ways of working is to ensure that we create a bigger table and bring more diverse voices to that table. We believe that our work is stronger when we value diverse viewpoints and incorporate that feedback into our decision. So to that end, it means that we're having conversations like the one today in order to connect the dots across the sectors, to reopen and strengthen Wisconsin's economy, and also to ensure that there's strong early care and education system in place to support the effort. So prior to COVID, the department was awarded preschool development grants. Last year, it was awarded a $10 million federal grant that will allow us to perform a comprehensive statewide assessment and develop a strategic plan aimed at improving our early care and education system. The grant has 4 areas of focus. One is attracting and retaining early care and education professionals, empowering families to make the best choices for their children, building regional networks of support, creating local partnerships to assist programs in addressing the unique challenges they face, and increasing the overall quality of programs to meet the expectations of the local communities that they serve. Through this work, our vision is that by 2023, all Wisconsin families will have access to high quality, affordable local early care and education opportunities. The process is going to rely heavily on stakeholder input along the way. We've just recently completed some of our regional listening sessions, and there'll be more opportunities for input. Since COVID, Wisconsin has stood up the Childcare Counts program. We've invested $51 million for the Childcare Counts program, all of which will be spent in this calendar year. Through those programs, almost 3,000 childcare providers applied for the Childcare Counts, 2,000 for essential workers, 1,800 for the incentive pay program, and 700 for the temporary closure payments. It has allowed childcare to continue for nearly 75,000 Wisconsin children, and it helped keep over 19,000 childcare workers employed and receiving pay. What we're also doing is we're partnering with WWDA. In mid-April, the legislature passed a law that required a statewide assessment of the economic impact of COVID-19. And it was thought, at that time, it was thought this would be well beyond COVID. From that assessment, though, WWDA identified 3 priorities, including getting everyone back to work and recognizing the need for access to high-quality care as essential to the economy, along with broadband access and innovation. And that's something I think Josh mentioned, that after the fact, we can provide links to some resources, and we can provide a link to that report. Beyond the partnering with the local businesses and community leaders to develop plans for this ongoing support, the department is actively engaged in conversations with stakeholders and partner agencies about the needs in different communities and working through ways to explore and support childcare providers and families. We're also keeping a close eye on what's happening at the federal level to ensure we're prepared for any additional childcare funding. Ruth touched on, and I'm sure everyone has read, the various proposals that are being debated at the national level. So we are watching that closely, anticipating additional funding to be released by Congress as a part of further stimulus packages. So opportunities for the business community. Ruth gave some great ideas, advocacy, lobbying, of course. We have some other ideas as well from the department. First, the early care and education industry struggles with finding needed capital for startup and safety costs, especially with the reopening. The pandemic itself presents an opportunity for businesses to invest in local childcare to cover those startup costs and assist facilities in reopening to serve their workforce. So one area would be to review your recruitment and retention strategies and employee benefits. Look at areas where you could subsidize childcare, where you could perhaps prepay for slots that are already available in the community, and other family-friendly workplace policies. Investing in childcare programs close to you in your local community to ensure that local childcare can remain open. It's a win-win. It will increase productivity and reduce time off of employees for who are parents, and it will help support the local childcare community. Support childcare teachers, sponsor teacher salary bonuses, pay off loans or subsidize training, give back to the community in creating sustainable improvements and driving economic development. And then using your influence to advocate for childcare. Again, this is back to Ruth. You could be working locally to create sustainable improvements through state and local policies. As is always the case, DCF welcomes the business community in reaching out to DCF with any innovative strategies or ideas that you may be using or that you want to implement. While I talked about the preschool development grant listening sessions have just wrapped up, the Council on Workforce Investment is also a forum, as well as the Leadership Council on Early Years Forum formed under the Preschool Development Grant, in which business can have a voice. I would end with saying that we will provide a link to our website to provide valuable resources, and I'll also include my contact information as well if you wanted to reach out to me or to the department on any of these additional thoughts or ideas.
Wow, thank you, Margaret. Really appreciate the advice and the suggestions that you gave. This is really, there's not really a chance for a lot of feedback from 60 or so people that have been participating on this, but we've really come up with some great ideas from our presenters, whether it's Secretary Frostman talking about specifically about the work share program, about the pandemic unemployment opportunity, hearing from Ruth about specific ways to engage folks both at the federal, state, and local level. And then Margaret, those are some great ideas, which certainly would could be great topics of conversation when you're talking about investing in local childcare, sponsoring teacher salaries, of course advocating. But we're really seeing some incredible ideas today. So thank you very much to the presenters that have been here and that are going. I'd now like to introduce Louise Wilson. And if you give me 1 second, I need to unmute you.
I'm unmuted, I think.
Oh, okay.
Okay. Yeah, I unmuted myself.
Yeah.
Independent.
Okay. Well,
So-
thank you very much for joining us. So we've heard from our statewide advocates. We've heard from the Department of Workforce Development. We've heard from the Department of Children and Families. And now we're fortunate to hear from our nurse and kind of hear some policy from the Department of Public Instruction. So please take it away. Thank you.
Yeah, so I'm Louise Wilson, and as Josh said, I am the school nurse health services consultant with the Department of Public Instruction. And as DPI's only healthcare consultant, it's been my responsibility to develop infection control and mitigation measures for schools in conjunction with our State Department of Health Services. I also oversee the development of tools for school nurses and others to use to implement these measures. And I think it's important to realize that DPI provides educational guidance. We do not provide human resource employment guidance, but I think it's also important to know that in many communities, particularly some of the more rural communities, the school district is a major employer. So what happens in schools not only affects from a child care standpoint, but I think it also affects the community as an employer standpoint. And as we've kind of mentioned, schools, and what we've seen in COVID has really brought to the forefront what schools do offer, and has been mentioned, obviously, providing childcare places for children to be so that parents can be at work is a big responsibility. Obviously, education is what we provide, and and we want to do that quality-wise, and I know that Sheila will be talking about that. But then also, I think it's really important to look at and remember the huge amount of social and emotional services that school districts provide. So I think that COVID again has brought that to the forefront. So again, our point then, and my section is really the infection control and mitigation. So schools working together with the local health departments have an important role in spreading the disease and protecting vulnerable students and staff. The goal obviously is to return to more traditional forms of teaching and learning, provide educational and related services while preventing or minimizing further or future school closures due to COVID-19 or other communicable diseases. While the virus that causes COVID-19 remains in circulation and the general public remains susceptible, the mitigation measures of social or physical distancing, the use of facial coverings and masks, hand hygiene and cough etiquette, quarantine of exposed individuals, and isolation of those with symptoms or illness provide the only protection to students and staff. The more individuals a student or staff member interacts with, and the longer that interaction, the higher the risk of COVID-19 spread. The degree to which school districts are able to implement social distancing, cohort students and staff, conduct regular cleaning and disinfection, and teach, encourage, and support the proper use of facial coverings, hand hygiene practices, and cough etiquette will directly affect the transmission of COVID-19 in the school setting. These practices will also have a direct impact on how many individuals are exposed and how many individuals, both students and staff, will be required to isolate and quarantine at home. All decisions about implementing school-based strategies, again, social distancing measures, surveillance, and use of masks are being made at a local level in collaboration with local health officials who can help determine the level of transmission in the community. School plans are designed to complement other community mitigation strategies to protect high-risk populations and the healthcare system and minimize disruption to teaching and learning and protect students and staff from social stigma and discrimination. Lately, I've been kind of getting on my soapbox with the message that I've taken from Harvard's Institute of Global Health. And that message is that the single best policy to support school reopening prior to the development of a vaccine or treatment is suppression of COVID-19 to near zero case incidence via testing, tracing, and supported isolation. So again, what can business and business partners do to support schools so that they can reopen in person? I think we've heard a little bit about flexible attendance policies so that your employees can stay home if they need to take care of ill students or students who are quarantined. Again, a big message that we're part of it is don't send your sick kids to school. So that is always an issue that I see as a school nurse, is that, you know, even pre-COVID, particularly during cold and flu season, parents need to get to work and they will be tempted to send ill children to school so that they can be at work. So that's important. I also think that business partners can help with the public health messaging that needs to be done if we're going to slow the spread of COVID-19, so that students and staff then can be in school buildings in large groups. This means supporting and promoting facial coverings in your community. It means making it the norm in your community. It means finding ways that you could support testing in your community, and that might be offering your parking lot to the public health department to do testing for COVID-19. And then, of course, again, it's keeping ill people out of schools. So that again goes back to those flexible and non-punitive type attendance policies. So that's really kind of my reflections that I think as far as what I would say from an infection control and mitigation that employers could do. And so I'll turn it over to Sheila there, or I guess Josh might be introducing her.
Yeah, and first of all, thank you very much. And you know, it's I feel like I'm seeing my family practice doctor that tells me I can exercise a little more and you know, eat a little healthier. And so I think you know, I really appreciate, you know, the input, and you know, today when we've had this presentation, we've really been fortunate to not only hear from experts about what the challenges are, but really all of our panelists today have been able to provide action steps. If you as an employer or you as an industry association want to do something about this, you know, you may not like what the nurse Wilson has to say, but she's giving direct advice. Same with our secretary, same with our policy analysts. So really appreciate the council and the presentations today. And again, kind of post these presentations, or pardon me, post this event, we're going to have some of these on a blog that we're going to feature as well. I also would like to introduce Sheila now, also from the Department of Public Instruction, to provide some additional thoughts and some opinions or kind of some action items that folks can take. So certainly appreciate you participating. So Sheila, why don't you go ahead and take it away?
Great, thanks so much, and thanks for having me. You're really close on my title as Assistant State Superintendent at the department, and so I happen to, you were real close, I happen to have all the workforce investment as well as the early childhood and childcare all kind of situated within my division, as well as a lot of the work in leading some of the back to school guidance that we're doing from the department. I'm going to try and find a niche here that no one else has really addressed to just give you a few things to think about and hopefully some real concrete steps as well. One of the things that I want to just make sure that everyone's clear on, I mean, it's kind of obvious, but it's not. Like when we talk about schools closing, we're really talking about school buildings closing because schools didn't close. And so I want to talk a little bit about the fact that during all of this, school continued both in the spring and it's going to again in the fall. And so the piece that we haven't really addressed is the fact that parents and employers and schools are facing pretty much one of three scenarios for what's going to happen this fall. Either going back full-time in person in a building, and then that obviously makes things easier when it comes to childcare. It makes it much more challenging when it comes to virus mitigation and containment. So that's one option. And the thing that I would say about that is I would ask for you to plan ahead in great flexibility with that, because the likelihood of that being the starting scenario and potentially having to change, I believe is high based on what we're seeing in other places. We're going to have other states that go back to school earlier than Wisconsin does, and we're going to see what's happening. We're going to be learning what's happening. I anticipate that some decisions that have already been made may be changed based on what we start to learn in that. So if your employees are in a school district that has said we're going back face-to-face, just know that that may not remain in that format. We have some schools and districts that are doing some sort of hybrid back to school where there's staggered schedules, or they're in-person 2 days and learning from home on 3 days. They're not off for 3 days. They're learning from home in a remote setting for 3 days. And then, as we know, there are some schools and districts that are choosing to start the year in a completely remote learning environment. And so one of the things that we're working on right now is we also have a variety of scenarios for families and how they can manage that. So if their students are home partial or full-time and they are working, they either can work from home or they can't work from home. And so as you heard folks talking about childcare and how we can get a safe environment for students during the day if their parents have to report in person to their job, we have to find a safe place for our youngest students to be supervised and fed. And I think the thing that wasn't talked about, support them in remote learning because they're still going to school. And so one of the things that we've been working on, we're focusing right now primarily in Milwaukee, but trying to make sure we have community providers, childcare centers, in conversations around what regulations and rules we need to try and get clear answers on around how we can provide space for these students that are doing remote learning during the day to have a as safe as possible, supervised environment that fits within the health guidelines, where an adult can not only make sure they're supervised and safe and fed, but also accessing remote learning. And so we're trying to make sure we remove any barriers for that. And so we would want, we're hoping to provide as many spaces are necessary for workers that need to be able to report to work in person. But again, as Louise mentioned, if a kid gets sick or a staff member gets sick or the center has to close because of an outbreak, again, we're going to be needing flexibility with parents in doing that remote learning from home. And then in situations, as Secretary Frostman mentioned, where employees are able to work from home, and again, the Department of Public Instruction also, I think, has been pleasantly surprised at actually increased productivity in many areas in being able to very successfully work from home. So we would ask for as much flexibility from employers as possible in being able to allow employees to work from home. And that flexibility might not just be work from home. It might also be flexibility of hours so that they can get their kids started on remote learning in the morning and then maybe work a little later into the evening. It might be look different than that. It might need to be alternating work week options. If there are 2 adults in the home and one has to work in person, one can stay home, as much flexibility as possible, because parents are facing an incredibly challenging situation in trying to work at the same time as they're supporting remote learning with their students. And so any flexibility you can give at all, or that you can have employers encouraged to give to relieve some of that pressure would be incredibly helpful, I think, for parents that are in a really pretty untenable situation of trying to work full-time and support their children in remote learning full-time. So thanks for your help with that.
Thank you very much. That was some, again, very insightful information from the Department of Public Instruction. I think one thing that an opportunity that we may be able to follow up on also, just kind of given the time, thanks for everyone kind of keeping it to our hour, is, Sheila also mentioned things like finding a safe space for these kids to go, or supporting remote learning. I mean, these are big policy items that I'm sure she could go on for hours on, and the work that they're doing with local workforce development, with local clubs like the Boys and Girls Clubs, and looking for other alternatives. So I want to acknowledge that, and I want to acknowledge all our speakers that really would love the opportunity each to spend an hour talking about some of the things that we're doing. So I want to thank them for their participation. I really want to thank everybody who listened as well. I'd like to acknowledge the work of the Wisconsin Workforce Development Association and recognize us as the 11 regional workforce development boards as a really a central point of contact for us to address workforce needs associated with, or the challenges associated with workforce as a result of school delays or changes in the way schools operate, as well as childcare. So clearly, as I talk, participants are dropping off Jerry Maguire style. So I will thank our folks and follow up. I know there were some suggestions that people provided. We'll follow up. And thank you very much for everyone participating. Thanks, everyone. Take care.